Hi guys, this is Dr. Robert Wolkers, and I'm going to be starting with a video today about the total knee replacement. So without further ado, I'm going to be taking you down here to the knee. Let's pick the left knee here. So what you guys are looking at right now is the front of the left knee. It's going to have a couple different parts here. You're going to have your patella, you're going to have your femur, you're going to have your proximal tibia, you're going to have your fibula there, fibular head, and then also you're going to see a couple different structures here. So first off, you're going to see your condyles back and through here at the knee. You're going to see your patellar surface coming through there. And then you're also going to see where that fibular head and tibia meet on the posterior side here, posterior, lateral. Coming through, you're going to see a couple of different cartilage structures. This is the articular surface of the tibia, and then this is going to be the articular surface of the femur. Now, what you don't see here is I'm going to add it in is going to be all our tendons and ligaments. So I'm going to be pulling this back here. You got a couple bursa that are located here at the knee. You're going to have the patellar. This is basically the patellar tendon, hits the kneecap, and then turns into the patellar ligament. It's kind of one structure there, but there is a little bit of a difference. On the medial side there's your tibial collateral ligament, also known as your MCL. Okay, so then the MCL is strained when there is a force on the knee this way. So if you are standing and kind of looking at the knee, let me shoot back a little bit so you can kind of see. People who have a force on the knee, say if you're playing soccer or football and you get hit there, there's going to be that force coming on the inside and straining that guy. No different than the infamous LCL out here on the outside of the knee, that when you have a force kind of pushing on the inside of the knee, it's going to strain that outside portion, especially when the knee buckles like that. Okay, so also coming in here, there's going to be a couple of different structures. Let me hide some of this capsule. So hide that guy. Let me hide this guy back in here too. And then that way we're going to expose the PCL. So there's your PCL there. One of the big ones that kind of gets the PCL torn is that once you hit the front of the knee there, kind of like if you're in a car accident and the tibia translates backwards, you're going to stress the PCL itself. Now, if I come in a little bit closer here, I'm going to move a couple of different structures. Hopefully I could get it. There you go. There is the ACL. So the ACL itself prevents tibial translation anteriorly. So that means that this guy's here and here, and then it's attached to your tibia and it's attached to your femur. So what it does is it prevents the tibia from sliding forward there. So a lot of times when the ACL gets stressed, you get the tear in the middle here because it translated too far. So basically if you're here and here, so I turn this way, and your tibia goes to translate forward, it becomes taut and doesn't. That's why when a doctor or a personal or a physical therapist or athletic trainer will pull and do the Lockman's test to really tell if there's laxity there or if they feel that tautness there in the ACL, is basically what they're looking for with that test. So it's deep in there. It's deep in the knee, as you guys can see from this picture. So I'm going to kind of click out of here. We're going to come in a little bit further so I could show you guys. Let's see. Let's hide this as well. Get the synovial membrane out of the way. This is your lateral meniscus. So if I fade all the others, you can kind of see the lateral meniscus has that more of a C shape to it, or excuse me, circular shape to it for the lateral meniscus. The medial meniscus here is going to have more of the C shape. So you can see the difference between the two. Basically, if I have the C shaped here, and here's more of the circular shape coming in. Okay. So very important there. So when things start getting broken down here at the cartilage itself, you're going to start to get that compression that we talked about before in our hip video. So here's our knee itself. I'm just going to try to draw this real quick. Basically, when that cartilage in the middle here starts to break down, the femur and the tibia start to rub against each other, and you start to get a lot of pain and a lot of loss of mobility. So I'm going to switch applications here. I'm going to come over to my Orthopedic App. These apps are made from 3D Medical. It's a great company. I don't really have any affiliation with them. I just really enjoy using their software, as you can tell. So I'm going to stop the video real quick. I'm going to pull this up. There you go. I think that's a little bit better of a picture here. Kind of move me over. Great. So as you can see here, we have the patella, we have the femur, we have the tibia, and we have the fibula itself. So I'm going to let this thing kind of ride out here. We're going to see a total knee replacement. So basically what happens here is you're going to start to see the breakdown in the cartilage. It starts to turn that surface there. Cartilage is really broken down. And then you have that bone-on-bone area. And then here's the spurring. And then there's that compression, degenerative joint disease going on. We have back and through the patella here. They're going to start chipping away at all the surface of the bone behind the patella, around the femur itself. Then they're going to cut this whole top ridge off of the tibia. There you go. And one more is going to be back and through here in the patella, but they're going to smooth it down with that drill coming in to give you your stem. They're going to give you a couple of different aspects up here in the femur with some cement. And then that way when the prosthetic goes, it can adhere. Some of these are done with or without the cement itself. So then there you go. There's your two prosthetic ends, one on top of the tibia plateau, and then one here on top of the femur. Just coming down here, you're going to have your smooth ridge, and then you're going to have the back side of the patella also gets a little cement, and then also gets a prosthetic. And then basically they put it all together, and there is your total knee. So basically the goal here is to restore range of motion, decrease pain, and improve mobility by getting a total knee replacement. So the femur itself is going to have a nice prosthetic here at the end, backside of the patella, on top of the tibia plateau, and then also you're going to have this spacer in the middle which attaches those, so then that a nice smooth surface, so you can still maintain that flexion and extension. For you guys that don't know what that means, I'm going to come over here to complete anatomy. I'm going to pull up my guy Fred here, and then if you guys bear with me here, I'm going to pull up a couple different muscles. There you go. Come down to the quad. And then I'm going to show you exactly what flexion and extension looks like. So here's extension of the knee. So it goes back into flexion and then kicks it all the way out straight. It's going to go back into flexion and kick it out straight there. That's bending it in flexion, kicking in an extension. So when you get a total knee replacement, that motion will be restored, and you should be able to walk, negotiate steps, get in and out of a car, and get back to recreational activity without pain or discomfort after a couple of months. So this is Dr. Robert Wolkers with Haymarket Physical Therapy. This was a total knee replacement tutorial, and please click on or subscribe to our YouTube page for other videos, and I look forward to seeing you guys. All right, thank you.